Emily Johnson, and I'm going to be giving a speech today over the Affordable Health Care Act. And on March 23rd, 2010, the Affordable Health Care Act was signed into law by President Barack Obama. The ACA primary goals were to make health insurance affordable to most people, expand Medicaid program to cover all adults with income below 138%, and support innovative medical care delivery methods designed to lower costs of healthcare generally. With the new president being sworn in January, the healthcare policy is at the forefront of America's debate in determining who will be covered and who will have to pay to receive adequate healthcare coverage. Through my research, I have found much controversy in what Americans believe is the right way to healthcare. Healthcare policies provide benefits for some, but not for all. For example, CNN reports 20 million people have gained coverage under Obamacare, but still 8.6% of the population is uninsured. So what services will remain available and what will change with the new healthcare policy changes is above the most important questions above Americans. The Atlantic magazine proposed the 2018 budget for the department includes plans to trim its funding by over $600 billion over the next decade. The major issue with this is whether or not it will weaken public health. With the budget cuts coming, many Americans believe that we should follow in the footsteps of healthcare reform of other countries and adopt the universal healthcare reform. For example, the Daily Commercial stated it is time to move forward to universal coverage with Medicare for all and not backward to coverage for some. It is the American way to adopt equality for all, and many Americans believe that a universal healthcare policy will make all Americans equal. The main thing, though, for other Americans, is that it's time to stop funneling healthcare into able-bodied adults. In a recent interview with House Budget Committee Chairman Representative Diane Black, The Hill reported that she intended to push for a change in Medicaid reimbursement to ensure that Medicaid dollars are used properly to support vulnerable citizens. This includes veterans, disabled Americans, children, and the low-income poverty families. With budget cuts, though, we are worried about what cutbacks will mean for the terms of benefits and coverage. The Huffington reported that budget cuts would undo Medicaid expansion and would take hundreds of billions of dollars out of the rest of Medicaid, so states would take major cutbacks. The question is, how will the doctors and hospitals get paid? When we take away money from Medicaid, many people think that it is Trump's fault for being misguided in the view of the Americans. On the Late Night Show with Stephen Colbert, he said that if anything, Trump should emphasize with a bunch of people who have been handed a bunch of money that they didn't earn. So many people think that Trump doesn't realize what it's like to be an American citizen, and therefore don't think that he understands the tremendous detriment that the budget cuts will cost. So with all of these points, we can see that many Americans have a lot of concerns about the new healthcare reform that is going to be taking place in the coming months to a year. And I'm frozen. And so with all the debate, we see that there's a lot of controversy in what people think is the right way to healthcare and what is the wrong way to healthcare. So there's really, with all the changes coming, we just have to be open-minded and remember that a policy will not fit each and every person, and there's two sides to every coin. Thank you.